This is absolutely astonishing
Yeah.
that people on the front line of our emergency services, those trying to make us all better, are now experiencing the highest level of violence towards NHS staff in 5 years, happening
Yes.
on your watch under this government. What on earth has gone wrong?
It's completely unacceptable. I mean, the idea that anybody would attack somebody who's working to protect them, to keep them healthy. Paramedics are often in the front line of this, but also nurses and doctors. I've seen it myself in A&Es, you know, late at night. And it is completely unacceptable. So we're going to take a whole series of measures to tackle it. So it will be an aggravating factor if you attack somebody who is works in the public service, works for you, trying to make you better. And also, we're putting in place a stronger link between the NHS and the police and the Crown Prosecution Service.
It actually can be quite stressful using the NHS. Sometimes, you know, my family, we use it regularly, variety of different reasons. Every family does. If you go into A&E and your A&E department is not meeting its target and you're feeling desperate about something, can put you under an awful lot of pressure. The staff are under an enormous amount of pressure. You know, these can be flashpoints, can't they?
Well, there's more people going to A&E than ever before. There's been a sharp rise in the last few years. That's one of the reasons that there is more pressure on A&E. And I hope that the extra £20 billion for the NHS announced by the Chancellor on Monday, if that can help address this problem of violence against staff as well, then that is all to the good. But nevertheless, we've got to take action directly also against people who are perpetrating this sort of violence. There's been a zero-tolerance approach in some parts of public services, for instance, the London Underground.
There was something called NHS Protect that was perfectly in place to protect NHS staff, and that was changed back in November 2017 into a department that just looks after investigating fraud, which is equally important. But you guys neglected it for the last 2 years.
Well, we're certainly not neglecting it, and that organisation, of course the name has changed, but the purpose of making sure that NHS staff are protected is an incredibly important one and remains, and in fact we're strengthening it with the measures that we're taking today. I also want the regulator, the CQC, to look more carefully at this issue and make sure that when they're rating hospitals, they know that they've checked that the hospital management have also put in place processes to protect staff and are doing all they can to protect staff. Because, you know, my view is whatever the reasons, and they are, as you say, they're complex, whatever the reasons, I'm going to do everything I can to stop the violence against NHS staff, because I find it completely unacceptable.
And absolutely. I mean, no excuse for it.
No
you would
excuses
acknowledge that if people are in the most sensitive, vulnerable, difficult, frightening time and they can't get an appointment with somebody, they can't be seen at A&E, they can't get access to mental health services, that's not a good environment, is it, for those people, those patients and staff sometimes to be interacting. And of course, you mentioned the 20 billion extra. Now that people have had time to crunch those figures, you know, we've got quite a critical reports of whether that 20 billion actually stands up. The Health Foundation think tank says that in real terms, there will be a reduction in funding for the NHS England of £1 billion or 12%, because spending on public health in England and training for doctors and nurses, which is not protected, is set to fall next year. Do you acknowledge that?
I don't accept that there's a £1 billion reduction for NHS England. There's a £20 billion increase that we announced. I have seen that report, and I don't recognise the description that it has, because there haven't been any reductions in this budget. On the contrary, we've put in an extra £20.5 billion. So the central point, though, that about the violence is that I'm reluctant to to go down the route that you encouraged me to, because the blame sits with the people who are being violent. Now, in the NHS, of course, sometimes it's very complicated because NHS staff not only deal with people in A&E who have no excuse, they also deal with people who may have severe mental illnesses, and so sometimes it is very complicated dealing with violence. But nevertheless, where it is from somebody who's come in through A&E and they're frustrated, even if they are frustrated with the system like you described, there is absolutely no excuse to be violent against the very people who are trying to treat you.
No, absolutely, and nobody's providing an excuse for it. All I'm describing and asking you to acknowledge is that there has been enormous pressure on the NHS, and pressure creates tension.
Well, I certainly acknowledge that there's pressure on the NHS, and the demand going up has been very sharp, and this is why we responded this week with the extra £20 billion.
Now, I mean, there may be more pressure to come. In fact, if you speak to some NHS managers, they say there's almost certainly more pressure to come, because now you're on record to say that despite what happens with Brexit, you think the NHS will be protected, this investment will be absolutely fine. But you speak to NHS managers and they are saying very clearly that it could be catastrophic. It will be catastrophic. So there's going to be even more pressure placed on staff and on patients in the NHS in years to come. How can you say, when no one has a clear idea what's happening with Brexit, how are you the one person to say, well, actually, doesn't matter what happens with Brexit, I know that everything's fine, despite the people that are working for you, NHS managers, are disagreeing with you?
Well, I'm not sure that I've recognised that picture because I'm confident we're going to get a good Brexit deal. Now, in the event of no deal for Brexit, there are a series of things that we need to do to make sure, for instance, that we have the unhindered flow of medicines, and we're doing that. We're putting those actions in place. I appreciate that no-deal Brexit would be more difficult, but I'm confident that we will get a good deal. And in any case, the biggest concern is in terms of the staff, the millions of staff in the NHS and the thousands who come from the EU. And we have said very clearly that not only will they be allowed to stay, but they're very welcome to stay. And in fact, there's been an increase in the number of EU staff in the NHS since the referendum. And I'm very pleased about that, because that shows that that EU staff remain welcome. And that's an important message.
If there is no deal, and a lot of people fear that that is the most likely possibility at the moment, can you still guarantee £20 billion extra for the NHS? Yes.
So I don't think it's the most likely outcome by a long stretch. I'm confident we'll get a good deal. But nevertheless, it is responsible to plan for no deal, even if I don't want it, and I don't think it's the most likely option. The £20 billion allocated on Monday in the budget, it will be there whatever the outcome on Brexit. And the reason for that is clear. It's because we need to put more money into the NHS so that we can guarantee it for the long term, so that it's always there for you and for viewers and everybody's family and loved ones.
Is that something that you've agreed with the Chancellor? Because he has said that if there's a no deal, then he'd have to come up with another budget.
Well, that's all very well, but the £20 billion set out for the NHS is absolutely committed.
Yesterday on the programme, when we talked to the Chancellor, because he has a mug with Chancellor Philip Hammond on, we suggested that he might have an ambition to have a mug with Philip Hammond, Prime Minister, on. He acted as if we'd given him something toxic. If you were to drink out of Matt Hancock Prime Minister mug, would that be an ambition fulfilled?
No. No.
That means yes.
No means no. I'm 40 years old and I'm the Health Secretary, and I'm thoroughly enjoying doing that, but it's a massive job and there's an awful lot to do, not least making sure that we have a zero-tolerance approach to violence on NHS staff. Which
absolutely is the right message you want to end on. But when we talked to Jeffrey Archer a little bit earlier, he said, don't believe any politician who says they don't have an ambition to be Prime Minister, apart from Philip Hammond. So when you went into politics, was it your mission to eventually, who wouldn't want to run the country if they're already a politician?
No.
Oh, come on.
No, I mean, look, I take this attitude that politics is public service, just as working the NHS is.
No, fine, but if a group of your fellow MPs came to you in a Commons today, took you aside, said, listen, we've got this plan, we think we can prop you up as a candidate for the next leadership, would you be up for it? Are you going to say, no, I'm not interested at all, I'm not in politics for this?
No, and it's not going to happen anyway. And what more importantly, you know, it's about making sure that the things that you're responsible for, like the NHS, like social care, which I'm also responsible for, is there for people. That's what gets me out of bed in the morning.